Good morning. This is Follow the Science Monday COVID-19 update. I'm Dr. Paul Juarez, Professor and Vice Chair for Research in the Department of Family and Community Medicine at Meharry Medical College. I'm also Principal Investigator of the Tennessee Community Engaged Alliance Against COVID-19, also known as Tennessee SEAL, and Site PI for HealthWorks, a HRSA-funded COVID prevention program established through a subaward with the Morehouse School of Medicine. Today is Monday, January 9th, 2023. So the million-dollar question is, where do we stand now? The answer is COVID is still with us and is likely to be with us for the indefinite future. But like flu, it appears that COVID may be settling into becoming a seasonal disease, a nuisance for most, but still serious and even fatal for those with weakened immune systems. We will, in all likelihood, continue to experience new subvariants, such as the current XBB.1.5 in the upcoming months. Each new Omicron subvariant appears to spread quicker, but also to recede just as quickly, but to not be more lethal. And people who have not had Omicron or received the bivalent booster will continue to get COVID. Many will get it over and over again. But if there's a change from Omicron to a new variant, all bets are off, and we may have to revisit stricter public health measures again. While there are no current indications that this will happen, the huge number of cases that are now occurring in China increases the risk of a new variant emerging. Taking all of this into consideration, I have decided it's time to cut back my weekly Follow the Science updates to bi-weekly for now and less frequent as the pandemic moves into an endemic stage. Moving forward, I will provide updates on new developments in COVID, followed with national and Tennessee data. So starting with updates. The Centers for Disease Control and Prevention is tracking the latest Omicron subvariant called XBB.1.5. This new subvariant has spread faster than previous subvariants and now accounts for 44.1% of cases nationally. While it is spreading more rapidly than previous subvariants, it is no more lethal than its predecessors and is likely to run its course in a short time. One of the greatest challenges we now experience is that vaccine hesitancy has now turned into vaccine weariness. To date, only 15% of the people in the United States have received the Omicron bivalent booster, despite the strong evidence of its effectiveness. Many people are weighing the pros and cons of getting the bivalent booster and deciding to accept the risk of getting COVID now that it has become less lethal. And while this may be a risk that many people are willing to take, those who are immunocompromised or otherwise at high risk still need to take preventive measures, including getting the bivalent booster, wearing masks indoors, especially when rates in their communities increase, and increased ventilation. But we must be careful so that vaccine weariness arising from COVID doesn't get in the way of the need to get other routine vaccines, including regular childhood immunizations, flu, pneumonia, HPV, and shingles. All of these vaccines offer important protections against serious illness and death. So let me turn to the national picture. The holidays have led to the expected increase nationally in COVID-19 cases, hospitalizations, and deaths. While the growth in hospitalizations and death are concerning, metrics remain far below their all-time highs. Around 47,000 people are currently hospitalized with the coronavirus, up 18% from 2 weeks ago, and an average of 509 persons died each day over the past 2 weeks from COVID, up 15% from 2 weeks ago, and the highest number seen since last March. But test positivity ticked down from 15% to 14%, which suggests that the worst may be behind us. If previous trends hold, we can expect the current surge to pass in another 3 to 4 weeks. Tennessee, meanwhile, has seen a significant surge in new reported COVID cases, hospitalizations over the holidays. Over the past 2 weeks, the average daily number of reported COVID cases has increased by 5%. In contrast, the daily number of persons hospitalized from COVID has increased by 29%. The daily number of persons in the ICU has increased by 45% to 128, while the number of deaths has decreased by 61% to 4 per day. The test positivity rate in the meantime has increased to 21%, up 7% from 2 weeks ago, suggesting high levels of community transmission. Test positivity and their number of hospitalizations remain the most accurate reflection of the level of community transmission. 52 counties, over half in Tennessee, are currently in the red or yellow zone. There are currently 22 counties in Tennessee in the CDC's red zone for community transmission. 10 in West Tennessee, but not Shelby County, which is in the yellow zone. 7 in Central Tennessee, including Nashville-Davidson County, and 5 in Northeast Tennessee, but not Knox County, which is in the green zone. 11 other counties in both West and Central Tennessee are in the yellow zone, while 4 in East and Southeast Tennessee are. The CDC recommends that people who live in areas that are in the red zone take extra preventive measures, including getting boosted, wearing a mask indoors, and increasing ventilation whenever possible. For persons living in Tennessee, the data suggests that if you are not boosted, you are currently at high risk for getting COVID. Don't let your guard down prematurely. Get boosted. Wear a mask in public indoor spaces where indicated, and provide good ventilation where possible. For now, this is Dr. Paul Juarez from Tennessee SEAL and HealthWorks. Let's make this a happy and safe new year.